I would come into the patient's room, perform hand hygiene. I'm CJ Lores. I'm a student nurse here at the College of Nursing. I'm going to be performing a neuro assessment on you today. Is that okay?
Yes.
So I assess the patient's appearance. I notice the patient is sitting upright. She has good posture. She has good hygiene. She is dressed appropriately. Now assess behavior, which is a level of consciousness. She's awake, aware. Her speech has been clear. Do you have any depression or anxiety?
No.
If the patient said yes, I would use some screening tools to investigate further. I will now assess cognitive functions. So, can you tell me your name?
Michaela.
Can you tell me where we're at?
Your house.
And you tell me the time.
The afternoon.
Okay, that's all correct. Now, for a recent memory, can you tell me what we had for lunch today?
Sushi.
We were together, so we did have sushi. And for remote memory, can you tell me who the president was before Trump?
Obama.
Okay, and now we're going to test the thought process and perception. So for abstract, whenever I said needle in a haystack, what do you think?
Something's hard to find.
Okay, for judgment, what do you think that you're going to be doing in 2 years?
Graduating nursing school.
Okay, that's all correct. So now I'm going to assess the cranial nerves. The first cranial nerve that I'm going to assess is cranial nerve number 1, which is the olfactory nerve. To test this nerve, I'm going to have you occlude one nostril and sniff the other nostril. Okay, so now I'm going to have you identify some scents. So I'm going to have you close one nostril and identify a scent and close your eyes.
Orange.
Okay. And then I'll do the other.
Lavender.
Okay, so you correctly identified both of my scents. So cranial nerve number 1, the olfactory nerve is intact. Now for cranial nerve number 2 is the optic nerve. To identify this nerve, I'm going to have you, I'm going to use a handheld eye chart. I would normally use a Snellen eye chart, and I would have you stand 20 feet away. And if your vision was 20/50, you would see at 20 feet what the perfect eye saw at 50 feet. But I don't have that, so I'm going to use my handheld eye screener. I'm going to hold this 14 inches above your face, away from your face, and I'm going to have you cover one eye. And I would normally test this bilaterally, but I'm going to do this just for one eye today. Okay, so cover one eye.
3, 7, 4, 2, 5, 8.
Okay, so your vision was 20/30, so you see at 20 feet what the perfect eye would see at 30 feet. So, cranial nerve number 2, the optic nerve is intact. Now I'm going to test cranial nerves 3, which is oculomotor. I'm going to use my pen light, and I'm going to note that your pupils are about 5 millimeters bilaterally. And now I'm going to test pupillary light reflex. So I'm going to test for direct first. I'm going to have you look at me, and I'm going to shine the light. Okay, so I know that for direct light reflex, I shine my light into this eye, and this pupil constricted, and now I'm going to do consensual light reflex. Okay, so for consensual, I shine my light into this eye and this pupil constricted, so that is consensual light reflex. And now I'm going to have you look at something off in the distance. Okay, and now look at my pen light. And now follow my pen light into your face. Okay, so that was direct. We tested for perlat, which means your pupils were equal, round, reactive to light, both consensual and direct. They accommodated and converged based on what you were looking at, and they converged on their axis. So they accommodated on what you were looking at, near and far, and they converged on their axis. So that was cranial nerve number 3, which is oculomotor. And now we're going to test for cranial nerves 3, 4, and 6. Cranial nerve 3 being the oculomotor, 4 being the trochlear, and 6 being the abducens. So to do this, I'm going to assess for the 6 cardinal positions of gaze. So I'm going to have you look at me, and I'm going to have you follow my pen line. Okay, so that was, I did no parallel tracking, and there was no nystagmus. So that was cranial nerves 3, 4, and 6. So now we're going to test cranial nerve number 5, which is the trigeminal nerve. To test this part, I'm going to have you clench your jaw, and I'm going to palpate your jaw. Okay? And now I'm going to have you clench your jaw and bring your palm down. Okay? That was the motor portion of cranial nerve number 5. So that's the sensory portion. I'm going to lightly swipe the cotton ball along your face and just tell me whenever you feel it. So close your eyes.
No, 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 no.
Okay, so that was the sensory portion of cranial nerve number 5. So cranial nerve number 5, the trigeminal nerve, is intact. Cranial nerve number 6 is the abducens, and we tested that with 3, 4, and 6. And then now we're going to test cranial nerve number 7, which is the facial nerve. So I'm going to have you smile, frown, puff out your cheeks, raise your eyebrows, and close your eyes and prevent me from pulling them open. Okay, so cranial nerve number 7, the motor portion, is intact. For the sensory portion, I would normally place something salty or sweet on the anterior 2/3 portion of your tongue, but today we're not going to do that. So cranial nerve number 7, the facial nerve, is intact. For cranial nerve number 8, which is the acoustic nerve, I'm going to have you close one ear and identify a word.
Nursing.
Okay, so now do the other ear.
Backpack.
So you did correctly identify both of my words. So there's no high frequency hearing loss. So cranial nerve number 8, the acoustic nerve, is intact. Cranial nerve number 5, which is a glossopharyngeal nerve, is we're gonna do this with 9 and 10. 10 is being the vagus nerve. To test this, I'm going to use my pen light, and I'm going to have you open your mouth and say ah. So I know that your uvula rose with fontation, and I would normally place something salty or sweet on the 1/3 posterior portion of your tongue. So, but we're not going to do that today either. So cranial nerves 9 and 10 are intact. Now for cranial nerve number 11, we're going to, which is a spinal accessory nerve. I'm going to place my hand on your cheek, and I'm going to have you push against my hand. Okay, now this way. And now hunch your shoulders and prevent me from pulling them down. Okay, so cranial nerve number 11, the spinal accessory nerve, is intact. Cranial nerve number 12, which is a hypoglossal nerve, I'm going to have you stick out your tongue, and I'm going to note that your tongue is midline, and I'm going to have you say the words light, tight, dynamite.
Light, tight, dynamite.
Okay, so you're able to correctly say the words. So cranial nerve number 12, the hypoglossal nerve, is intact. Now I'm going to test the motor system, which is, and we're going to test for cerebellar function. So I'm going to have you stand up, and I'm going to have you walk 10 to 20 feet.
Can I go this way?
You can go that way. Okay, and now I'm going to have you tandem walk and just do heel to toe. Okay, so that is good. And now I'm going to do a Romberg test. I'm going to have you turn away from me and close your eyes. And I'm going to balance just to, in case you fall. Okay, I would normally do this for 20 seconds and test that, but I'm not going to do that today. So that's the balance test, and you had a negative Romberg test, so you can sit down now. Next, I'm going to test for sensory. And to do this, I'm going to show you this is sharp, and this is dull. So I'm going to have you close your eyes and identify the sensories.
Sharp. Dull. Sharp. Dull.
Okay, now we're going to test the deep tendon reflexes. So now I'm going to test the tricep, the bicep. I'm going to support the patient's arm. Okay, and now for the brachoradialis, I'm going to, okay, so now I'm going to do the patellar, and I'm going to have you just, relax your knees. And now for the Achilles, I would support the patient's foot and hit the back of the heel, okay, and now, so to identify the reflexes, they were all on a 2+ scale, so they were all normal. And now I would do the Babinski's test. I would take this end of the hammer, and I would run it along the patient's foot, and I would want to see movement of the toes. Okay, so you had a negative Babinski test, so that is good. So all the reflexes were 2+, and then the Glasgow-Coma scale is something that you would assess the level of consciousness over time, and I've been doing that throughout the entire procedure. The eyes is on a scale from 1 to 4. The motor is on a scale from 1 to 5, and the verbal is on a scale from 1 to 6. And the highest you can receive is a 15, and the lowest is a 3 or less. So that concludes my neuro assessment.